Dr. Frederic Mau. Frederic, it's good to see you. We were having a wonderful time last year, and I know you are very, very busy. You have so many things on your plate. You are at the time teaching a class, and you're preparing conferences, etc., etc., etc. So I really do appreciate you taking the time. The objective of our interview, of course, is to help people understand what is your seminar about. So, to put it into a nutshell, if you had to describe the seminar in one sentence, or very briefly, what is it about?
Well, Dr. Preetz, Norbert, my friend, it is delightful to see you. I really appreciate it, and my time is yours, and I'm always happy to speak with you. Thank you, and thank you for inviting me along to teach the seminar. I'm very excited about it. So if I had to put it into a sentence, I would say I will teach processes that are excellent for creating physical pain relief for your clients. So we're getting rid of physical pain.
Yeah. What one or two typical situations or problems does this seminar address that many therapists know from their daily work?
Well, physical pain makes any kind of mental health or life coaching issue worse. And so if people are in pain, but they are also down or depressed or phobias or anxiety or trauma or whatever, it can make things worse. And the pain could even be associated with a trauma. Again, we're talking about physical pain. So anything that you're working on where your client has physical pain, whether it's related to what you're working on or not, if you can get rid of physical pain, it's going to help. Some simple examples, I think, would be something like people who suffer from migraines. And so we want to get rid of the migraine. The migraine may or may not be related to whatever it is that you're working on, but just getting rid of regular migraines will be substantively helpful to your client and also will help whatever else you're working on. Or maybe someone was, injured in an accident, like an automobile accident, and they're dealing with trauma from it, but they're all emotionally, but they're also dealing with like chronic physical pain that's come from the accident. If we can get rid of the physical pain component of it, that is helping to heal the trauma. So it might be something related, it might seem unrelated, but it's all in the experience of your client. And so helping them to physically feel better is just a huge benefit for anything else you're working on. And you might be just working with someone on physical pain. They may come to you because they have chronic back pain or something like that, fibromyalgia. And so they're not actually bringing something else to you to work on. They're just like, I have this pain, and you can get rid of it, which is beautiful.
Yeah, yeah. There are a lot of seminars out there, a lot of seminars, hypnosis seminars about pain relief. Not every seminar is for every person. So who is your seminar for and who is it not for?
I mean, really, I believe my seminar would be for people that practice hypnosis. If they're completely new, then we can definitely work with them. I'm not teaching basics of hypnotizing people. So, but I would say anyone from a fairly new practitioner in hypnosis to someone with a lot of experience with it, but just maybe has never worked with physical pain. If pain has not been something you've worked with, then this will provide excellent skills for you. If it is something that you've worked with in your practice, I think you will have more of an understanding of how the process functions within the brain, and also some new models for how to do pain relief that will be really helpful for you. So it's a way to get going, but it's also a way to expand your knowledge base and your skills. So I do feel across the board this can be helpful. I know that there's a hesitancy on the part of some hypnotists to work with physical pain. People wonder about, well, this is a signal from your body that's telling you something important, or maybe there hasn't been a medical diagnosis or something like that. We will definitely talk about responsible and ethical ways to do this that actually serve your client, that will not get in the way of medical diagnosis or signals that your body needs to send you. So if you've done pain relief, but you've been a little bit unsure about it, this I think will give you some more framework around it that will make it even more practical and useful for you to help your clients.
Partially, you have answered my next question.
I'm just prescient that way.
In the seminar, you have referred to very interesting studies that really helped to understand the development of pain. And it was not just theoretical knowledge. This knowledge gave us concrete things to apply. So, what 2 or 3 concrete outcomes do the students gain in terms of knowledge and, of course, in terms of skills or tools?
Well, I think it is helpful to understand how our processes actually work. I think some people are content to just have a tool that they use. And if that's what you want, the seminar will definitely provide that. But if you want to have more of an understanding of how this is actually operating within the brain, we're going to provide some information. There were, of course, people that were lay hypnotists in the last seminar that I did with you that I think really benefited and enjoyed it. There were several physicians that were in the seminar, and I think, I was able to speak with them as well within the context of the seminar. But by having at least a basic understanding of the neurology of hypnosis and hypnotic pain relief, I actually think it helps you to be able to be more effective with your client because you can understand what's going on with them. In the United States, the terminology may be different in Germany, but in the United States, like standard practices of medicine are called standard of care. And so they're kind of the level that we always want to be at with medicines or therapies or medical devices. There are complementary approaches that are below that kind of go along with it and you can use with it. And then there's like alternative processes. But the thing to realize is that for hypnotic pain relief in the United States, we are recognized by the government as not just standard of care, but a cut above that. We're recognized as a best practice for pain relief because the science behind it is so solid. And so I think that understanding how this operates in the brain and having that confidence in how it works, being able to explain that helps you view what's going on with your client. It also helps you speak to medical and mental health professionals in your community in a way that builds your credibility for you and your practice.
Yeah, and it's so helpful to have a mutual understanding, a mutual language that you can communicate with other physicians or other healthcare providers.
Absolutely. Yeah.
This is one of the things that is getting easier for students after the seminar. What else becomes easier for participants as a result of your seminar?
Well, I think just confidence in working with pain. Again, I think it's something that people can be afraid of. Also, we have some primary things that we are teaching that are just core approaches to use. And so I think people get a lot of confidence from that. But we'll also talk about things like using maybe some unusual things for pain relief, like using very fast, rapid or instant inductions can be very helpful for certain kinds of pain relief. And so we'll talk about like putting those skills in place. And maybe you haven't done that in your hypnosis training. We'll show you how to do it. And so we want you to have several different tools that can really work with people in different ways. There's a protocol that actually you and I developed as we were working on the workshop that I think gives essentially what amounts to a flow chart of how to approach things with a client that is most likely to be successful and what to do if it doesn't work immediately. Like what's our next step that we go to and how do we handle that? And so pain relief is so powerful that it just tends to work off the top. But even if it doesn't, then we're not leaving you hanging. We're giving you like a model for how to approach everything.
Mm-hmm. And I like the flow chart very much because it gives you a step-by-step instruction. It shows you where you are. And interestingly enough, most patients benefit from only 2 sessions? And what if not? And you know where you are. I found it very, very helpful.
Thank you so much. I really appreciate that. Yeah, there are a couple of core metaphors that I use. One is just really designed to create numbness. The other one is playing with sensory perception channels in the brain. And between the two of them, they're hitting things in very different ways. And it's just very, very helpful. And then that's going to cover really the vast majority, but we'll also spend a little bit of time talking about, well, okay, on the edge cases, what are some other things to look at? What can be going on? What are some approaches you can take? So we want you to be really confident and really fully equipped to go help your clients who are dealing with physical pain.
Mm-hmm. And for what pain, what kinds of pain is your approach working, helpful?
Well, pretty much all of them. So there are four. There is acute or subacute pain, which is like a wound to the body, like you get a cut. And so you've got someone that's just been injured on the spot. We can talk to you about ways to deal with that. There is chronic pain that persists, different diagnoses, different periods of time, but say 6 months or longer. It's persisting over a long period of time. This is actually processed differently in the brain from the acute pain, and is related to psychological pain like depression. And so we're working on, how to treat that. There's neuropathic pain where the pain comes from damage to the actual nervous system itself. This is usually from degenerative diseases like diabetes. But we definitely look at, and that is a very squirrely, very difficult kind of pain in general to treat, even with medication. But the process is very solid for it. We do a really solid job with that, and we'll talk about understanding it and how to handle it. And then there is what's called nociplastic pain. So if you're familiar with like fibromyalgia, it sort of falls into that category. It is sort of a global kind of pain that's operating in a little bit of a different way. Very effective for that. And so there are these various kinds of pain that have been identified by the medical profession, and we will talk about how our process engages those, both in practical terms, what to do, and then also in understanding what's actually happening with the neurology of it, so you know what you're doing.
Therapists who work with pain can understand or gain a lot of understanding from what you've said already. Mm-hmm. Furthermore, what makes your training different from standard trainings?
Well, I can't comment on other people's trainings that I haven't been in, but my trainings in general are known for their hard science, their diligent research. They're very empirically grounded. I'm looking at medical studies. It is not pseudoscience. We are not working off of anecdotes. This is a standard of care or best practice process, and we're also, I have more than 20 years of experience in working with clients, and I've actually learned a lot from my clients. My experience with my clients has taught me many things, and so the processes that I'm sharing with you are things that I've developed over years working with clients to get them to be really good and really solid. And then also, I can tell you that I have a disc in my back. I had this before I became a hypnotist. I had a period of my life where I spent basically 9 months in enough pain that I really couldn't do something like go to the store because I couldn't stand on my feet for that long. I was able to get up and go to work and sit down and work and then leave and go back and sit on the couch. But that was about it. And when I learned hypnosis and when I learned hypnotic pain relief, it was phenomenally helpful for me personally in addressing that. And really, that is the reason why we're sitting here talking today. That really is what took me into hypnosis as a field. Now, I treat all kind of things. I treat trauma, I treat anxiety, I treat depression, functional neurological disorders, and dissociative disorders. I'm a mental health professional. I'm licensed in the United States, but pain relief is close to my heart and really, really brought me here. And I do treat a lot of people continuously people over time. Not the same client, because usually they get better and then they go. But I do treat people. I have treated people for pain relief the entire time I've been in practice, and it is deep and meaningful work for someone who's been in debilitating pain, and then they're like, I don't feel it anymore. It's amazing.
Yeah. So you know both sides of the coin.
Well, I guess maybe three. Like I know the neurology of it. I know the practical work of it with my clients, but I also have the personal experience with it. And for example, something like headaches, like I just don't get them. I mean, if one's kind of beginning to develop, I can get rid of it. I mean, having this in my life, having this sort of pain relief in my life is it's beautifully helpful. Over the last couple of years, I've had a couple of different surgeries over the last maybe 3-4 years. It was phenomenally helpful to me during recovery, and yes, it's been personally beneficial. So the science of it, the practice of it, and also the personal application of it.
Yep. And knowing what it feels like and knowing what incredible relief it is helps you to understand how big the gift is, what you help your patients to achieve.
Yeah.
Is there an experience you have had, especially and intensive in your therapeutic life, that is especially helpful for you in your work? And why is this helpful and important for the seminar?
I can give a couple. One was I record hypnotic processes when I do them with clients, audio recording, and I also have recorded processes for myself, like for back pain. And I haven't had to use them for years and years. In fact, I'm not sure where they are now. I had them on I don't think they were cassette tapes. I think it was like CDs that I recorded them on. But several years ago, we were popping popcorn, and there's hot oil with the popcorn. And I don't know how I did this, but I managed to stick my hand in the hot oil, which I do not recommend. And that, of course, immediately cool a burn. So I turned around to the sink and threw cold water on it, and like my hand was red, like red, and just phenomenally painful. But I didn't have any lesions, and so I didn't. And then coming back in.
Mm-hmm. Fred, we had a little cut here. I lost you for a moment. So
Okay.
your hand was red, really red.
It was really red. It hurt just terribly. But I didn't want to go to the emergency room. So I went and I listened to the recordings that I'd done for my back, and I could feel the pain push out of my hand and it kind of come back in and push out and come back in and push out and come back in. And my hand stopped hurting, and it looked bad for I'd say about a month, 3-4 weeks, but I don't have any scars, and the hand is just fine. It was phenomenally helpful. I also can think about a particular client who came in. This woman had been badly injured in an automobile accident, and she just had severe chronic pain, and she also exhibited like really severe depression. But sometimes she would pull out of the depression, but the pain would like pull her back into it. And I was like, so you're not really a depressed person, like you've just got a lot of pain, and so your natural tendency to swing away from it, but the pain pulls you back. And she's like, yeah, I think that's what's happening. And I'm like, yeah. And so we were able to knock out the pain in a couple of sessions. This was even years ago. Like I'm better at it now than I was then. But we were able to knock out the pain in a couple of sessions, and she was in tears, like she was delighted, overjoyed. And then, interestingly, she went to her doctor to tell her doctor that she did not want to take the pain medication that she was on because, like, she wasn't feeling pain. And the doctor, I did not know any of this happened until afterward. The doctor was like, no, you got to stay on it. Like, that's just crazy. And so she took herself off the pain medication, which I really have hesitations about because it can give you severe withdrawal, which it did. So she had a bad week with withdrawal, but she was like, yep, I'm off the pain medication. I'm not hurting. My doctor's really mad at me. So I'm going to get a different doctor, but thank you. And like, I am better. And I'm like, wow, the way you did that. But okay, sure. All right. It all ended well. I'm delighted.
Yeah. What
So
a
there you
change.
go.
What a change.
Mm-hmm.
Students who come to the seminar, want to help their patients, their friends, their neighbors? No, if possible. Is there one technique, one intervention we learn in the seminar that is applicable immediately after the seminar?
I mean, the two major techniques are both immediately applicable. As you know, one of them I've called the wintertime process and one I've called the summertime process. You can use them. They're just operating differently, but like everything that I teach you in the seminar, is immediately applicable. The core processes that we do, I think, are pretty straightforward for anyone that's done hypnosis in the past. Some of the other things that we're teaching, I think, have a bit more finesse with them. But they're really good. They're really lovely. Incidentally, I'm in the United States, of course, and you were in Germany. I have continued to be in contact with some of the seminar participants who have reached out to me and have had feedback from some of them on pain that we worked on relieving within the seminar that's still gone, and they're doing really well. And so they've had the occasional question here or there or whatever, and it's lovely to have these relationships.
What happens in the seminar? What is the relationship of theory, practice, demonstrations, questions and answers? What can students expect?
You will see processes, techniques that you can use immediately with your clients modeled. We will do them in the seminar. I will do them working with seminar participants, with your colleagues who are there, or maybe you there taking the seminar. You will absolutely see these demonstrated. You will also have an opportunity, several opportunities, to practice these skills. Hypnosis is a skill. It's not just information. It is about skill development. And so we'll model the process for you. You will practice it with each other, and then we will give you feedback on your practice so that by the time you're done with the seminar, you feel confident actually going and doing the processes with your clients. And I can tell you from the last seminar that there were some things that we were doing that there were experienced hypnotists who said to us, as you recall, that they had never done that before, but they were delighted with it and doing it like in the practices, and looking forward to bringing it back into their own work, their own practices at home. We will also go over information for the neurology of this. You'll have things written down. Specific studies will be cited. And I think in many cases we actually provide the studies, or if you feel like you want them, we can always get them and give them to you. I'm not generally citing studies. I'm talking about particular things. You know, there's the Beliki study from 2012, and here's what they found. So we are looking at actual science, peer-reviewed documentation that backs up how we're doing what we're doing. I feel like I'm a very approachable presenter. I enjoy interacting with the participants in the seminar and having, conversations during the breaks, and just that sense of camaraderie with colleagues. And I really enjoy those experiences. And so I feel like the seminar has a characteristic to it of you get to really have a nice full experience while you're there of like what we're doing and what we're working on.
Mm-hmm. Now, there are therapists that say, I'm already experienced. I'm working with pain for so and so many years. Is it still worth it for me?
I mean, I don't know, maybe not. Like, that's a decision that they have to make. They probably will learn some new techniques, unless they spend their time doing a lot of work in like neurological and medical journals. They will probably learn some new science that gives them more substantiation for the processes that they're already doing. I find that whenever I've been in practice for a long time. Someone asked me the other day, I was like, well, I've done keynote addresses on 4 continents at conferences, and not just 4 keynotes, like a lot of them. Anytime I go to a colleague and I listen to their training, I always find something that's useful. There's always a new idea or a thought or a technique that I hadn't thought of, or something. Like I think we just approach our learning with like a sense of humility. So I consider myself to be a really very good hypnotist, but whenever I go and study with someone, or take even like a an hour workshop at a conference or something. There's always stuff to learn from anyone that does what we do. So, I'm bringing a lot of experience to this and a lot of background. And I think that even if you're really experienced and you've been doing it for a while, you at a minimum really enjoy it. I'm confident that you're going to come away with some things that were at least a new spin on it for you.
Yeah. Yeah, I have demonstrated at least 1,000 times how to switch off acute pain in seminars. And I've worked with quite a few pain patients, chronic pain patients. And I must say, I was so delighted and pleased to see your approach. I really felt enriched. And yeah, for me, the seminar was just great, and I've learned a lot, I must say.
Well, I want to say two things about that. One is thank you, and the other is you're a psychologist. You have been practicing hypnosis probably longer than me. I mean, for decades. You are, from what I can tell, just an excellent trainer. You're certainly highly respected. And the things I've learned from you just being with you as a colleague, I haven't sat in your workshop, but as a colleague, like there is just a wealth of depth and information, and clearly you're an obvious expert in our field. And so for you to say that, like, I really sincerely appreciate it, and it's meaningful. And so, yeah, if the question is, do you think experienced practitioners are going to gain something from the workshop that will be helpful for them? You would be the example of that. So you're the person to answer that.
Yes.
So yes.
Yes.
Yeah.
Definitely. Absolutely.
Yeah.
Let's round it up. What is personally the most important reason for you why this seminar is especially important right now?
Freeing people of physical pain, I think, is the most significant thing you can do for a person that has pain. I'm not discounting like psychological effects of trauma and stuff, but no, like if a person is living in chronic pain, to be able to free them of that, I don't think there's anything bigger that we can do for a person's life, for their functioning. It's just liberating. So let's say that you completely failed at getting rid of like their flashbacks or whatever from trauma. They're still way better off if you got rid of pain. Oh my goodness. Also, in my opinion, pain relief is, I would say, the most effective thing that you can do with our processes. Like, I think that there's a ton of stuff you can do with hypnosis that is phenomenally beneficial. But if you were to ask me, okay, Frederic, what is the strongest thing that you can do with hypnosis? Pain relief.
Yeah.
And the fact that not every hypnotist does it astounds me. And I understand some of the rationale. Again, people want to make sure they're doing it in a way that is right for their clients and so forth. But like, it is such a phenomenal benefit to people. And it really is core to like how our processes function. Like, it is just something, if you're a hypnotist, I feel like you need to do it.
And if someone still is undecided, what would you say to them, maybe in a sentence or two?
I mean, there are a lot of different workshops out there. If you think you can go take one of them that will give you a tool that will be of a greater benefit in someone's life than getting rid of their physical pain, go take that seminar. But this is life-changing. We use that phrase a lot. For someone to be able to move when they couldn't move, to not be in constant pain physically, yeah.
I've seen so many patients in severe pain, and many of them told me life is not worth living with this intense pain that hinders me in working and doing what I love and playing with my kids or grandkids. I can't think and feel anything else. So in my opinion, I totally agree. Pain relief is one of the biggest gifts you can give somebody to release a huge burden and to free him for a life worth living. So,
there are very few diagnoses where, well, I'll put it this way. There are certain pain diagnoses, physical pain diagnoses, where just the suicide rate is phenomenally high. And, while there are other things like you can have suicide with major depressive disorder and stuff like that, I'm not aware of anything where we are as concerned about suicide as we are with certain pain diagnoses. So if you want to think about a gauge of how extreme is this, like that. And so if you've got someone that like, I'm in so much pain, I am thinking of killing myself. What have you got? Well, as a practitioner, I think you want an answer to that question that is strong. Yeah.
Frederic, it has been a pleasure seeing you again. And I'm really looking forward to the seminar in October. You are a great teacher. You are a scientist. You are a teacher. You are an entertainer. You teach in a very pleasant way, and you're a wonderful person to be with. So I can't wait to see you in person in October. Thank you for your time. I really appreciate it, and all the best to you.
Norbert, thank you so much. I am so coming back and seeing you and being in Magdeburg. I'm really looking forward to the seminar, and thank you.